The saddest experience one could have would be to have a friend or a family member, someone that you love, need CPR and you not be able to give it.
Put yourself in that person's shoes and realize, okay, well, if this were myself or this was a loved one, what would I do?
Well, whenever I'm talking with other moms, I just always urge them to get that training, seek that out, because you never know when you could save your child's life.
CPR, like any other medical procedure, is not 100% successful. However, what it does always do is give someone a chance. And I really think it's important to get that chance.
My feeling was that I had saved someone's life. I had allowed myself to step out of myself.
In that moment, it was very calm and very, just very matter of fact. You just rely back on that training, and it just kicks in, and you know what to do. After it's over, then there's this overwhelming sense of panic. Oh my gosh, what just happened? And then there's a sense of relief, because you just, you just don't even want to think about what could have happened if you didn't know what to do.
My name is David Kalman.
My name is Diane Carter.
I am Rose Talbot.
Somebody's not happy with lunch.
Yeah, he should have gone to the Shook Shack.
Get that email from Natalie?
What about the cats?
Yeah. What was that?
Do you think he needs help?
No. It's probably nothing.
I don't know, Steve. He might have a serious medical problem.
Nina, it's not our problem.
I'm going to check it out.
Come on, Nina, don't.
Sir?
I hope you know what you're doing. You might get sued. You realize that?
Is everything okay here?
Something's wrong with this man.
I'll get a first aid kit and call security. Security?
That guy must be drunk.
I'm Nina. I have training in first aid. Is it okay if I help you? Can you tell me what happened? Can you tell me your name? Sir?
He has diabetes. We need to get him help right away.
Can you tell me what happened here?
He suddenly fell over. His medical ID says that he has diabetes. I think he needs help.
Okay, I'll call 911. Security officer, one from the food court. Yep.
When you find a person who appears to be unconscious, follow the emergency action steps. Check, call, care. Check the scene for safety. For a child, obtain consent from a parent or guardian if present. Then check the person for responsiveness. If the person doesn't respond, call for help. If the person is face down, gently roll the person face up, keeping the head, neck, and back in a straight line so you can provide care. Once the person is on her back, open the airway by using the head tilt, chin lift technique. To perform the head tilt, chin lift technique, place one hand on the forehead and 2 fingers on the bony part of the chin. Then tilt the head back as you lift up on the chin. Maintain this position. For a child, do not tilt the head back as far as you would for an adult. Check for breathing for no more than 10 seconds. Look to see if the person's chest clearly rises and falls. Listen for escaping air from the mouth and nose. Feel for escaping air against the side of your face. Normal, effective breathing is quiet, regular, and effortless. In an unconscious adult, you may detect an irregular, gasping, or shallow breath. This is known as an agonal breath. Do not confuse this with effective breathing. Care for the person as if there is no breathing at all. If an adult is not breathing, quickly check for severe bleeding, then begin chest compressions. If a child is not breathing, give 2 rescue breaths, one after the other, before checking for bleeding and giving care for the conditions you find. Use a CPR breathing barrier if available. Tilt the head back and lift the chin up. Then pinch the nose shut and make a complete seal over the child's mouth. Blow gently for about 1 second. Each breath should make the chest clearly rise. If the chest does not rise, re-tilt the child's head and try another rescue breath. After 2 successful rescue breaths, quickly scan the body for severe bleeding and care for the conditions you find. If at any time an unconscious person begins vomiting, the airway could become blocked. Roll the person onto one side, and then use a finger to clear out the mouth. Once the mouth is clear, continue to provide care based on the conditions you find. If the person is unconscious but breathing, maintain an open airway with the head tilt, chin lift technique, and monitor breathing and for any changes in condition until EMS personnel take over. If you cannot maintain an open and clear airway because of fluids or vomit, place the person in a modified Haynes recovery position by moving the person to her side while keeping the head, neck, and back in a straight line with the knees bent. If you need to leave the scene to call 911, modify this position by tucking the hand under the head. If you encounter an infant who appears to be unconscious, follow the emergency action steps: check, call, care. First, check the scene for safety. Obtain consent from a parent or guardian if present. Then, check the infant for responsiveness.
Baby.
If the infant doesn't respond,
okay?
call for help.
Call 911. This baby's unconscious.
With the infant on his back, open the airway by using the head tilt, chin lift technique. To perform the head tilt chin lift technique, place one hand on the forehead and 2 fingers on the bony part of the chin. Then tilt the head back slightly as you lift up on the chin. Maintain this neutral position where the head and chin are neither flexed downward nor extended backward. Check for breathing for no more than 10 seconds. Look to see if the infant's chest clearly rises and falls. Listen for escaping air from the mouth and nose. Feel for escaping air against the side of your face. Normal, effective breathing is quiet, regular, and effortless. To give rescue breaths, use a CPR breathing barrier if available. Tilt the head back and lift the chin up. Then make a complete seal over the infant's mouth and nose. Blow gently for about 1 second. Each breath should make the chest clearly rise. If the chest does not rise, re-tilt the infant's head and try another rescue breath. After 2 successful rescue breaths, quickly scan the body for severe bleeding and care for the conditions you find. If the infant is unconscious and breathing, maintain an open airway and monitor breathing and for any changes in condition until EMS personnel take over. Shock is a life-threatening condition that occurs when a person's body is struggling to meet demands for oxygen and blood supply. The signals of shock present themselves in different parts of the body. The person can feel apprehensive or anxious in the early stages of shock, then grow listless and confused and be unable to speak as shock worsens. Breathing might start at a rapid rate, then become slow, shallow, and irregular if shock progresses. Body temperature will decrease slightly at first. As shock worsens, body temperature will drop much lower than normal. Skin will feel cool and appear ashen or pale, then grow colder paler, and clammy.
Pulse rate will increase slightly in the early stages of shock and change to rapid, weak, and irregular as time elapses.
As shock worsens, the person's organs can shut down, which can cause death. Calling 911 immediately and minimizing shock can save a person's life. Here are some steps to minimize shock. Make sure that 911 or the local emergency number has been called. Have the person lie down. Since you may not be sure of the person's condition, leave him or her lying flat. Control any external bleeding. Help maintain normal body temperature. Reassure the person until a trained responder or EMS personnel take over. Don't give the person anything to eat or drink, and monitor the person for changes in condition.